I treat companion animals, which means mostly dogs and cats, but tortoises, rodents, guinea pigs, rabbits, sometimes chickens. The qualified veterinary surgeon being ultimately responsible for the outcome of a case, but that's only possible with a team of trusted and highly trained people that we can delegate certain aspects of that care to. Most vitally are registered veterinary nurses.
So working as part of the vet-led team, the veterinary nurses very much assist the vets in the day-to-day procedures in the practice. Everything we do is under the direction of the veterinary surgeon. As we have progressed with our training and the amount of knowledge we need to pass the exams, we've also become a regulated profession now. Currently, without our title being protected, anyone can call themselves a veterinary nurse. While we've moved on, the legislation surrounding it doesn't seem to have caught up.
We've come to recognise in the small animal world that lots of animals will benefit from hydrotherapy or physiotherapy after a surgery, for instance, as an orthopaedic surgery, for their rehabilitation or for management of chronic pain in arthritic dogs. It can be a bit of a challenge trying to work out where people fit in as far as their qualifications and their ability to look after that patient.
There is no regulation. So one of the things I struggle with is people with qualifications, particularly, that maybe a massage qualification. So maybe they do a weekend course, they set up as a massage therapist, and sometimes the advice they've given can have been quite wrong or quite dangerous, and it's very difficult at the moment to regulate that.
There is no protection of title, basically, so you could go and do a couple of weekends course in spinal manipulation and then call yourself an animal chiropractor. For me, it's quite insulting. I think it's quite for those of us that have worked really hard for our titles and our qualifications, I feel that it's something that really needs looking at and addressing. You look at a dog's shoulder, for instance, it's not held on with bone structure. This is just purely muscles, and if you stretch it in the wrong way, you can tear different things. I find that really quite scary.
For example, if a dog had some sort of spinal issue that had not been diagnosed and then went into a treadmill or a pool or whatever, you potentially could have catastrophic results from that.
And I think it's extremely hard for vets to know if they're presented with a consent form to sign for an animal to have one of these therapies. It's very hard for them to be on top of all the different qualifications people might have, and is that a really good level of qualification or is it not? And I think it's very hard for owners as well. So I think they'll tend to assume someone's got a certificate or a piece of paper, it's all the same, and it isn't.
I absolutely think it would be an improvement if there was a mandatory register for paraprofessionals. It would give us as first opinion vets greater confidence that when animals were going for hydrotherapy treatment, for instance, that there was going to be some regulation of those people, and therefore we would feel more comfortable that they were getting the service that we were hoping that they would be receiving.